Hi everybody, I hope everybody's having a really nice day. So today I am going to do a radiation safety class through the State Department agencies of health are requiring that we have a radiation safety course so that we can be compliant with their regulations. So all existing employees and employees that are coming in clinically will need to watch this video so that we can be compliant with the state health agencies. We'll be expected to watch this video as well as sign a log saying that we have watched this video and understand its contents. So there's going to be a paper in each radiology department that you'll have to sign if you're working at that clinic stating that you have watched this class. Okay, so if you work in various clinics such as Boise, we do work in different clinics around here as well. So for each clinic that you work in, you will have to have your name on a log stating that you've taken this radiation safety class. Just so if the State Department of Health comes in and gives us a visit, we'll be compliant with that. Okay. I appreciate everybody's attention, and we'll make this quick and painless, and we'll just go over a few things so you have understanding of what radiation safety is. So let's get started. There's a couple different types of radiation that we're concerned with. The first one is non-ionizing, which is like the sun. Okay, the sun is non-ionizing radiation. It's something that we can, put a hat on or put sunscreen on to protect ourselves from. And then there's ionizing radiation, which is what is used in X-ray radiation. To protect ourselves from ionizing radiation, we need to wear something that's a little bit thicker. We can't just put a lotion on and be protected from X-ray radiation. We actually need to use a lead apron, lead shield. For the type of X-rays that we do, it is required that we have a 0.5 millimeter lead apron or lead shield, and that's what ours are, 0.5 millimeter, just so you know. That is a test question, actually. What's the thickness of a lead shield? So ionizing radiation can be harmful to the body's tissues at a cellular level in large doses. The good thing about that is the type of X-ray that we do in our clinics it's not in really large doses. Primarily when we're doing extremities, we're using a really, really small dose of X-ray. But sometimes when we get up into the pelvis or the spines, we're using a larger dose just to get through the tissue that we need to. But it's important that we know that in large doses, X-ray can really be damaging to tissue at the cellular level. So human tissue has different sensitivities to radiation. So parts of our body that have low sensitivity would be things like muscle or connective tissue. High sensitivity would be mucous membranes, the esophagus, eyes, thyroid, gonads, any embryonic stage with pregnancy. All that is very sensitive to X-ray radiation. Very high would be lymphocytes and reproduction cells. Okay, so when we're X-raying somebody, we need to really strive to cover up those sensitive areas if we can, if it's not within the area of interest that we're looking at. And when I say cover up, I mean use the lead shield. Okay, so it's important to note that radiation dose is cumulative. Okay. When you get an X-ray, it just doesn't, go back to zero. Once your body has been exposed to radiation, the next time you get an x-ray, it just kind of builds upon that, okay? And we don't know people's history. We could get a patient in here that has had cancer and has had various CAT scans. And I might add that the CAT scans are a very high dose of radiation. For example, a CAT scan of the pelvis is equivalent to 100 chest x-rays. So you can see that the CT is much higher. So if you've got somebody that's had various CTs, they've already begun their accumulation of the radiation dose. And not knowing that history, we just need to be careful with everybody. The rule is with women, 0 to 55 years old are considered childbearing age. So anybody 0 to 55 and female, we need to be covering up, as well as children. As a rule of thumb, if I can use a piece of lead, I will. Okay, doesn't matter the age of the patient. For me, it's just important to protect wherever I can. So that is a good rule of thumb. Just use the lead aprons. Okay. Now we're striving to use as low a technique as we possibly can. And in X-ray or radiology, the word ALARA, A-L-A-R-A, is very important. And it means as low as reasonably achievable. Okay, that's something that's important for everybody to learn, because that will be some sort of test question. As low as reasonably achievable. So we're using the lowest technique that we possibly can to get the best picture that we can. There's really a fine line there. Sometimes, using a heavier technique, you may be able to get a better picture, but can we get a good picture with a low technique? And most of the time it's yes, but there are those times where you're going to have to use a higher technique, and that's okay. So that's what number 6 is, optimize radiation dose. Use the dose needed to get an optimal image. And that's what we're shooting for with everything, with extremities, fingers, hands, wrists, forearms, toes, feet, ankles. Those techniques are relatively low anyway, so it's not that big a deal. But once we start going into the abdomen, the spine, pelvis, we need to pay attention to the techniques that we're using. Now, all the X-ray machines within the Sterling company, they have built-in techniques to the computer system, and 95% of the time those techniques are going to work perfectly. You just choose your technique and go with it. There are times when you get a smaller or larger patient in there and you need to adjust that technique up or down. Now, we do have technique charts in all the clinics, and we need to be paying attention to those. If we get a patient that say is a small child, the technique charts that I've come up with, they have a technique for a small child, an adult, and a large adult. So it's important if we have somebody small that we adjust that technique down so we're not over radiating a child. Or if it's a large patient, we need to bring that technique up in order to pass through what we need to pass through to get an optimal image, and that's okay too. Now, the problem with not paying attention to that, if you have a bigger patient, your image is going to be suboptimal. So it's important that we pay attention to those technique charts and strive to get the best picture we can the first time that we take the image. And that brings us to the next one, which is positioning. Positioning of the patient is very important. We need to be able to see what we need to see. If we're shooting a forearm, we need to see the entire forearm. If we're shooting a femur, we need to see the entire femur, even if it takes 2 different pictures to do that. Okay. it's important that we're collimating or restricting our X-ray beam to the part that we're imaging. You know, if we collimate well and we get the whole part in there, our image is going to be better. We have less scatter radiation, which is less dose for us and the patient. So really pay attention to your positioning and take your time to learn that, okay? Collimating, I just talked about that, limiting the exposure to surrounding tissue. We don't want to be taking our pictures with the collimator wide open, especially when we're shooting a finger. I mean, there are times when it does need to be wide open if we're shooting an abdomen or a chest or something big. But for the most part, we're striving to collimate to the body part, okay, without cutting off any body part that's necessary for us to see. Avoid retakes. Okay, you know, retakes is the number one reason for patient overexposure. If we're not paying attention when we're collimating, or we're not paying attention to the technique that we're using on a larger patient, our picture is going to be suboptimal. That means that we have to take another one. That's just another dose of X-ray for that patient. And it's really not fair to them that we don't take our time and make sure we're imaging what we need to image with the proper technique. Okay, and that being said, I'm available for if you guys get stuck on a technique on a patient, not sure what to use, please call. If I don't answer right away, I will call back as soon as I can. But I will get you in the ballpark just on the patient size, and I'll be able to get you pretty dang close. So don't hesitate to call if you have that question. We're just trying to reduce the amount of retakes that we take. Okay, and that has everything to do with radiation safety. We don't want to over-radiate the patient because we're taking more than we need to. Okay, and shield whenever possible. Very important that we, you know, I've alluded to this before, but shield when we can. Okay, we need to take care of our patients, and we also need to take care of ourselves. When we can shield the patient, if it's not in the area of interest, we need to cover the reproductive areas. And thyroid, when we can. Thyroid is very, very sensitive to X-ray, and gonads as well. So take care of your patient and take care of you. If you need to be out there holding a patient, if you've got a child that won't hold still or what have you, or an adult that can't keep the body part in the proper projection, sometimes you need to hold that part for them. If you do that, make sure you're putting a lead shield on so you're protecting yourself, okay? Protect your patient, protect yourself. When you take a picture, it's necessary that we get behind the lead wall where the control area is, okay? That wall is made of lead, and it's there for a reason, to protect us from the amount of X-rays that we take. If we were to stand out there every time we take a picture, we're going to get over-radiated, and it's going to possibly cause damage to our body, and we don't want that. Number 11 down here is time, distance, and shielding. Okay, the big three in radiation protection. Time being our technique. Okay, if we're using a really high mass, our exposure is going to be longer. Okay, the higher our mass is, the higher our MA time is, the longer the exposure. And longer exposure means that patient's getting more radiation. Okay, we should try. It doesn't happen every time, and it's not possible every time. If we use a higher KVP and a lower mass, our exposure time is going to be shorter. Now keep that in mind when we're like shooting the pelvis or something, when we want good contrast. It's necessary to use a lower KVP and a little bit higher mass, and that's okay. But anyway, time. Try and keep your exposure times down. Okay, distance. Okay, the rule of thumb with distance is 6 feet away from the source, or 6 feet away from the X-ray tube itself. You're safe. That X-ray radiation is going to dissipate before it gets to you. So if you need to be not behind the the lead wall, you need to be at least 6 feet away from the source, and they call that safe, okay? But for me, it's always good to err on the side of caution. If you're not sure where 6 feet is, just make sure you have a lead apron on, or you are behind the lead shield where the control area is, okay? So shielding, and we've talked about that a lot. Just make sure you're shielding when you can, okay? You know, it really looks good for us when we shield a child and the parents in there with us. You know, it gives them some confidence in what we're doing, that we're concerned about that child and what's wrong with them. We're taking pictures, but we're also protecting them by shielding them, putting a lead apron on them, okay? Just keep that in mind. Okay, and the things we're striving to do here at Sterling right now is educating in safe operation of radiation producing equipment. Okay, the classes that I've been putting on for positioning, critique, and technique work, we're going to start getting into the physics end of it, how x-rays are produced. It's all about education, okay? So you guys know how to safely operate an x-ray machine. So we're keeping our techniques down and being fair to the patient when it comes to radiating them. Okay, that's why we're doing this. It's education. Okay. Number 2 is use protective devices whenever possible. Shield. Keep your exposure times down, and when you can, distance from the x-ray tube is always a good idea. So, you know, for the patient, they really don't have a choice. They're going to be either 40 inches or 72 inches away from the x-ray thing. And it's just our responsibility to cover them up with lead, okay? Or where we can cover them anyway. Number 3 is follow established protocols and procedures. Like I said, we have technique charts in all the departments. Try to adhere to what the machine says, or if you have a smaller or bigger patient, pay attention to what the technique chart says and strive to adhere to those so we're not over-radiating anybody. Protocols, along with those technique charts, it also tells you what projections you need to be taking, okay? Whether it be a wrist, which is a PA oblique and lateral, or a forearm, we need an AP in the lateral. And just for every body part, there's certain images that we have to take. So we need to abide by established protocols, okay, and procedures. Number 4, select technique exposures that reduce radiation exposure to patients and yourselves, okay? We've talked about that, selecting the proper technique for the proper body part, okay? Very important. Okay, number 5 is a big one, and in my traveling, I've noticed that a lot of employees don't wear their dosimeter badges, okay? That's this little fancy badge right here, okay? It's not going to protect you from any radiation, but it's going to let us know how much exposure you've taken as yourself, okay? How much radiation is passed to you. Now, it's important that we wear these at collar level. I wear mine on my lanyard. Textbook says wear it at collar level. If you wear it on your lanyard, that's okay. Just when you put a lead apron on, make sure that's outside of the lead, okay? We want a true depiction of what radiation you're getting, not what isn't passing, but the radiation that has come your way, okay? You know, everybody should have one of these. If you do not have one of these or don't know where it is, let your manager know, okay? We'll get you one ordered, or your manager will get you one ordered. If you become pregnant, let us know, and we will get a fetal monitor for you. You'll wear one up here and one down here, so we can see what kind of dose is headed your baby's way, okay? Now, that being said, if you are pregnant and taking x-rays, take really good care of yourself. Keep yourself covered. You know, try not to be the one out there holding a patient. Try to be the one that's behind the lead wall, okay? Take care of yourself and take care of your baby. That's number one. But let us know if you need a dosimetry badge, okay? Everybody should be wearing these on every shift, okay? If one of the state agencies comes in to do an evaluation of our x-ray machine, they're going to note that you're not wearing your dosimetry badge. So it's very important you wear these, okay? If that does happen and somebody comes in and you have questions, I've made a cheat sheet for you so that you can go off that. That will be in all the Idaho clinics, and we probably will put those in the Utah, Wyoming, and Montana clinics as well. That will be posted in your x-ray department. But if somebody shows up and you don't know, please call me and I can talk with them, okay? Don't let it freak you out. They're just there to help. But if you have questions, please let me know. Okay, very good. Wear your dosimetry badges. Okay, so the benefit of these practices right here is to minimize the possibility of causing damage to healthy biological tissue. Okay, X-ray can be harmful. It is a carcinogen when it's used in large doses. Okay, that's why it's important that we learn about radiation safety. What happens is with some people, not everybody, that X-rays will actually damage a cell in your body, and when that cell tries to regenerate and fix itself, sometimes there's a mutation and it doesn't fix itself right, and that's when you start having problems. So it's so important that we take care of us and take care of our patients. Okay. That's pretty much X-ray safety in a nutshell. Okay. Just know what you're dealing with. Know those parts of the body that are more sensitive and cover those up when at all possible. Shield yourself, shield your patients, keep your exposure times down, and just realize that radiation can be dangerous. But if we're using it in a safe manner, we're using the techniques that are on the chart or in the machine, we're going to be okay. Okay. I appreciate everybody's time today. Please reach out if you have any questions about any of this. And please keep attending my classes and learning more and becoming proficient with X-ray. It really is an exciting thing. I have the feeling that everybody should strive to get their limited scope X-ray license. It's a great thing to have, and it just shows that you really care and you want the best for your patient. And you guys are doing fabulous. I'm so proud of all you. Some of the changes I've seen in X-ray quality have been fabulous. So great job. So when you watch this, make sure you go to the department that you're working at, and there will be a sheet that you need to sign saying that you did watch this and you did understand what was being said. Okay, so that'll be in your home departments, but if you do travel to a different clinic, make sure you're signing that paper as well so that we're compliant with the state agencies. Thank you so much for enduring this, and I appreciate you all, and have a good day. Thanks, guys. Oh, and wear your dosimetry badge. See ya.